Sir, basically, when the patient comes to you, burn injury patient comes to you, some patient you advise them to ICU for ICU. So how do you assess which patient needs ICU, which patients don't doesn't need ICU? How do you
Okay.
assess?
So again, depends on what is the age of the patient. Extreme of ages are very friable. So like small kids and elderly people,
Hmm.
they are more vulnerable, and they should be definitely admitted to ICU.
Hmm.
And again, in normal young adults, again the percentage of the burns come into play.
Percentage of burn.
The
Okay.
more the percentage, the more severe the burn is, and they'll require ICU stay for a longer duration. And any burns of special kind like chemical burns, burns to the eyes, burns to the face, and burns inhalational injury. Whenever they inhale some smoke or there is burn injury because of inhalation of fire fumes, the airway will get burnt. These all are patients will require intensive care monitoring and intensive care support. So these are the patients who get priority over the other burns.
Basically, in child burn injury also, depending on the
Percentage,
of
how
burn.
much percentage is burnt, it depends on that.
Okay.
When you compare with an adult with the child, same percentage is far more severe and far more critical in kids than
Kids.
adults. So because they'll be having a larger surface area of the face compared to the body, the small part of the burn wound is very big for them.
Yes.
So it is very critical in children.
Sir, few personal question. Why do you choose this field? This did specialization on plastic surgery.
See, basically, plastic surgery was very fascinating to me during my surgery residency. We go to all kinds of postings. We do onco surgery, we do plastic surgery, we do neurosurgery, urology. We go to all postings, and the plastic surgery, I found it to be very fascinating. You can drastically transform someone's lives with a single surgery, and the microsurgery was very interesting at the time, very challenging both at the same point of time. So it was very interesting, and I thought this would be more fascinating for me. So I wanted to pursue more in that. So that's why I took plastic surgery.
What innovation in burn treatment you are more fascinating about?
So there are a lot of latest technology in burns, like tissue expansion, early excision and grafting, and nowadays there is bioengineered skin. The artificial skin is being made from the patient's own cells. We take some part of the patient's skin, they make the artificial skin in the lab with the patient's own cells, and this skin, once it is ready, it can be used for the patient itself.
Okay.
So the number of hospital duration stays will be less, the pain will be less for the patient, and it will be very easy to manage large burns with this.
In India, it's
No, it is still in the research level, but once it comes, it is a great advantage. So these are the latest technologies, and AI powered tools are also there.
Okay.
AI helps to assess the severity of the burn. By AI based photo models are there. Based on that, you can assess how deep the wound is. AI can basically, you show a burn wound to the AI, they'll explain how much percentage is deep, how much percentage is superficial. So they can assess based on the photography models.
This is the future.
Yes, future
Till
in
yet,
burns.
it's not available. This facility is not
Just it
available.
is evolving.
Yes. If you had to give any kind of advice to all our viewers, those who are watching these videos, what would be the piece of advice you want to give?
Simple thing: prevention is better than cure. When you know about something, you can prevent it. So patient awareness is very important. Society awareness is very important. So you should be aware what all are the common causes of burn, what to do when there is a burn injury, whom to contact when you have a burn. So this is a major issue where you don't know whom to contact. So nowadays plastic surgery is easily available in the cities, at least. You can get to the plastic surgeon. So immediate timely intervention is very important. By mistake, if you had got a burn, so whom to consult and what to get done. So immediate timely intervention, proper fluid management, you can make the areas more superficial and you can treat it properly. There are a lot of specialized dressings nowadays. Proper timely exact dressing which can be done, which can salvage the burn wound very nicely. Proper timely surgeries. So patient should know where to go, how to prevent it. If by mistake it has happened, what to do, what are all the treatments available. So this is the thing which can be prevented. If it happens, you should know what to do. So it is very important for them. And
Mainly
basic first
awareness.
aid.
Yes.
Awareness is very, very
Awareness is
important.
very
for
important,
this.
and first aid also.
First aid, and it is very traumatic for the child if it happens. So some basic small steps and proper care in the child can usually prevent. Usually don't keep child in a lap and drinking tea. This is most common
Yes.
method. Mothers or any grandparents keep the child in their lap and start drinking tea, or any hot foods they consume. By accidental spillage, immediately the
Yes.
child gets burned. This all can be preventable. If you know, you can prevent it. If you don't know, so it will be happening again and again.
One is preventive care. One is if it happened, then what is the
timely
things?
intervention.
Yes.
So where you have to go, whom to consult, what should be done. So this is all very basic
Very
education everyone should know, so that you can reduce the morbidity of the burn, you can reduce the patient's pain, you can reduce the number of hospital stays, you can reduce the financial burden on the patients, all this.